Historically, healthcare has been seen as the less exciting part of the agency world, but do you think that the restrictions, the regulations that we operate in actually provide more of a challenge and more something that is actually increasingly attractive?
Yeah, I really think that those people that are inherently creative, you don't always want to take the easy option. I think that the challenge that it represents is something that they have to put their heart and soul into overcoming. But I think if you do overcome those challenges, then you can have a more profound impact on people's lives. I also feel that sometimes as an industry we almost hide behind the rules as an excuse to perhaps not get involved.
What kind of new metrics, KPIs, objectives are you needing to put in place within your organisation to drive towards the right kind of behaviour and output?
So as CEO of Avastlinks, there's two aspects to that for me. The first is looking internally, and the second obviously is looking on behalf of our clients. When I look internally, I look at things like staff retention, I look at staff engagement, I look at feedback from the various services we conduct to make sure that people are proud in the work that they're producing. And with that knowledge comes the confidence that we're producing things that are having a real impact on patients and society. From a client and from a pharmaceutical point of view, I'm not naive enough to discount that ultimately we have to deliver return on investment, we have to increase market share, which is critical. But I also think it's important that they look at some of the softer metrics around their interactions with healthcare professionals and with patients. We've done a couple of campaigns recently which are probably relevant to this. There was the award-winning Care for Today initiative that took home 2 awards from last night. The metrics that go into that in terms of looking at patients' relapse, looking at how long they're spending in hospital, looking at potential savings and the absolute impact it's having on patient are for me very strong KPIs. Some of the campaigns we do around schizophrenia and hepatitis C, what we're measuring are the actions that people are taking when they're interacting with the services that we've provided. And making sure people aren't just browsing and going, they're browsing, absorbing and taking a progressive action in the treatment of their condition.
As mentioned, you were involved in 2 of the award winners from last night, the Patient Initiative and the HCP Initiative award, both going to Janssen. What's the reason, you think, why they were more successful than anything else that was presented to us in the last year?
Not one single factor. So I think there's a lot of contributing factors that drove towards that success. I think first of all, from a senior point of view, they've got a very clear vision and a strategy of how to get there. And over the past 3 or 4 years, there's been a real commitment throughout their organisation and in their partnership with us to fulfil that vision. I then think their culture is very innovative. I think the nature of our agreement supports that innovative and more agile way of working. And I also think they identified the need for more holistic, integrated patient journeys, and they understood the value that technology can bring to that. And as a result, they've delivered a tool which has brought a huge amount of value to patients and a huge amount of value to healthcare professionals, and not just in one therapy area, but actually in multiple, and both in Europe and also in the US. So a hugely successful healthcare innovation.
What do you think needs to evolve in the regulatory environment to enable pharma companies to get to where they need to?
I don't think it's necessarily external to pharmaceutical organisations. I think it's almost an internal issue. So I talk about the fact that in the last 15 years, your phone's gone through something you make calls through to something that you live your life through to some extent. So there's been an absolute digital revolution. During that period, the evolution that the pharma industry has been through is relatively incremental. There may be a newest e-business manager here, there might be an innovation team there. I think they have fundamentally got to really transform their way that they work, and particularly when it comes to medical and legal sign-off. And I think we need to recognise that the services and tools we build today can have a far greater impact if we actually understand them and approve them and consider them against the regulation in a much more contemporary and appropriate fashion.